The World Health Organization has made it clear that Mpox is not the new COVID-19. Even though the disease is gaining attention outside Africa due to a more contagious strain. With concerns rising in the wake of the COVID-19 pandemic, which caused around 15 million deaths worldwide, there is growing focus on the spread of Mpox. Thailand reported an Mpox case recently, though it's unclear if it's connected to the new clade IB variant causing an outbreak in the Democratic Republic of Congo. This variant has spread to 12 African countries and one in Europe, with over 17,000 cases and 517 deaths reported this year, mostly in the DRC. Sweden recently became the first country outside Africa to report a case involving the IB strain, which was traced back to someone who had traveled to Africa. Following this, the WHO declared Mpox a public health emergency of international concern. Although Hans Kluge, the WHO's European director, dismissed comparisons between Mpox and COVID-19, he emphasized the need for global cooperation to tackle the disease. Mpox is related to smallpox and can spread from animals to humans and between people through bodily fluids, close contact, or contaminated objects. There are two types of Mpox, clade I and clade II. Clade II typically causes milder disease and is less likely to be fatal. Symptoms include a rash, flu-like symptoms, and fatigue. The virus is still primarily spreading through sexual and intimate contact, especially among gay, bisexual, and other men who have sex with men. In the U.S., Mpox surfaced in 2022, resulting in 32,000 infections and 58 deaths. All cases were linked to the less severe clade II. The CDC states that the U.S. has not detected any clade I infections, and the risk of its arrival is low. However, experts like Dr. Kyle Enfield suggest that international travel could eventually bring the more dangerous strain to the U.S. Though its spread would likely be slower compared to respiratory diseases like COVID-19. Mpox infections usually resolve within 2 to 4 weeks without specific treatment. The CDC recommends over-the-counter medicines and prescription mouthwashes to manage symptoms and advises against touching or scratching the rash. The JYNNEOS vaccine, given in 2 doses, is highly effective at preventing Mpox and reducing symptoms for those who do get infected. The CDC recommends the vaccine for at-risk populations in the U.S. and provides a vaccine finder on its website.